Here at Oral Maxillofacial Surgery Associates, the doctors here, we take care of approximately 85% of the maxillofacial trauma in the South Alabama region. That involves anything traumatic to the facial structures involving the jawbones, nose, basically anything above the neck. Most soft tissue injuries generally involve simple lacerations, which are simple just stitches. Occasionally, depending on the structures involved, you may need something a little bit more extensive, whether that be nerve repair or salivary gland considerations. General soft tissue injuries, recovery time is less than a day. After that, you're back to your normal activities, and a little sore, obviously, but nothing that should keep you from doing any of your normal activities. Bony injuries to the face, the treatment for that all depends on what structures are involved. If the jawbones are involved, then often the jaws have to be realigned, which involves lining the teeth together into their normal occlusion, which involves wiring the teeth together. That sometimes will have to stay for up to 6 weeks if you have a broken jaw and it needs to be wired together. Dental injuries are taken on a case-by-case basis. If it's superficial to the tooth and the tooth can be saved, often your dentist will repair that tooth or even may need to get a root canal for it. However, if the tooth is beyond repair or if it's fractured in such a way that cannot be restored, then we will remove the tooth for you and then look at options of grafting it and implants and stuff to replace that tooth. Now, sometimes the tooth itself is not injured, but the bone encasing the tooth is injured, what's called an alveolar fracture. In those cases, generally the tooth needs to be splinted in place. Often it involves applying appliance, a lot like braces, that just hold the tooth there while it can heal. Sometimes, depending on how much trauma that tooth has taken, it may end up needing a root canal in the future.